So let us discuss about fracture of both bone of leg. What is both bone of leg? What are the two bones? Yes, your tibia and your fibula. Is that two bones are connected with something? Yes, the two form a joint, tibio-fibular joint, and these are some subcutaneous bones. Basically, tibia is your subcutaneous bone, but relative to tibia and fibula, fibula is very small size, but it has more muscle attachment. More muscle attachment. So here, periosteal blood supply is more. But in tibia, medullary blood supply is more. So these two are joined with by hinge joint. Hinge joint gives they relatively gives small movement. Mechanism of injury of this two bone fracture is basically direct and indirect. Direct is your RTA. Indirect is your bending and torsional force on tibia. Bending or torsional force on tibia. So again, this classification is very interesting. This classification, when we talk about classification of both bone fracture, it is two types. First, closed and open. Another type is level of fracture. Upper third, middle third, lower third. And regarding with respect to displacement of fracture, it is 4. One is undisplaced, sideways displacement, angulatory displacement, rotational displacement. Clinical features, there will be only one thing, history of injury to leg. That is the only one feature. Other things are fractures similar only. Your treatment, basically it is very important. It will change regarding closed and open fracture. In closed one, you will again divide it into two, whether it is undisplaced fracture or it is displaced fracture. If it is undisplaced fracture, you will do POP cast for 4 weeks and followed with patellar tendon brace for 6 weeks. This undisplaced fracture. If it is displaced fracture, then you will divide it into two, whether it is stable one or it is unstable one. If it is stable one, you will do closed reduction. Closed reduction can be done. In closed reduction, if you get any satisfactory result, can get satisfactory result or it can be unsatisfactory result. If it is your unsatisfactory result, you will do closed nailing. If it is your satisfactory result, then you will do POP for 4 weeks. POP for 4 weeks, and you change the POP for 2 weeks and check X-ray. If the satisfactory result after POP, if it is in the same position, not displaced, means then you will continue POP for again 12 weeks and patellar tendon braces for 6 weeks, 4 weeks if required. if it is displaced, not stable, not in the same position after the close reduction and POP casting for 4 weeks. For 4 weeks. 2 weekly change. If it is displaced, then you will do closed or open nail. Okay, this is one thing. In the top I said you there will be unstable fracture. If it is unstable fracture, you will directly do closed nail. And as I said in open fracture, how will you manage this open fracture? Open fracture. This open fracture is managed with regarding grades. Grade 1, grade 2, grade 3. Sorry. Grade 1 of open fracture is managed with wound debridement with POP cast. Grade 2 is wound debridement with the external fixator. Wound debridement with external fixator. And change to POP once heals. If in grade 3 you will do wound debridement with external fixator with early bone grafting. So that's up. Thank you.